Dr. John, recently a number of our clients have consulted us after suffering from hamstring injuries. Is that serious?
Yes, hamstring injuries are serious injuries.
Are you qualified to talk about hamstring injuries?
Yes, I'm qualified to talk about hamstring injuries. I'm trained as an orthopedic surgeon. I went to medical school at Georgetown, and I've treated hamstring injuries, including hamstring ruptures.
Can you help us understand the relevant anatomy as it relates to hamstring injuries?
Yes, in order to understand hamstring injuries, let's take a look at this anatomical slide. So this is a anatomical diagram of the hamstring muscles in the back of the leg. So what we're looking at here first is the tailbone, and then the calf is down here, and the hamstring muscles themselves run from the bottom of the pelvis down to the area surrounding the back of the knee. And again, the hamstrings are made of three different muscle units. One is the semitendinosus, the second is the biceps femoris, and the last is the semimembranosus. They all come together and attach at the ischial tuberosity here. Now, I want to try and distinguish between what some have commonly heard of as a pulled hamstring compared to a hamstring rupture, which is what we're here to talk about today. A pulled hamstring has to do with the muscle itself. In other words, the muscles are made up of the muscular fibers and the tendons that attach to the bone. Pulled hamstrings generally are related to the hamstring muscles, and pulled hamstrings are generally graded from 1 to 2 to 3. Let's take a look at this next slide to understand pulled hamstrings. In this next slide, what we're looking at is an example of a muscle. So the muscle is represented by this brown structure. And what we're looking at now is also the different grades of hamstring, getting a pulled hamstring. So one way to think about the grades of tears in a hamstring or a pulled hamstring is to think about the hamstring just like a rope. In other words, a rope can be stretched, a rope can be partially torn, and a rope can be completely torn. And that's represented by the grades 1, 2, and 3. In grade 1, pulled hamstring, you get a stretching of the fibers of the muscle. In grade 2, you have a partial tear. And in grade 3, you have a complete tear of that hamstring. What we're looking at on the right side of this diagram is there's a special type of grade 3 hamstring in which there's a full tear where the tendon attaches to the bone. Remember, where the tendon attaches to the bone, that's where a complete tear occurs, and that requires surgical treatment.
Dr. John, can you help us understand what function the hamstring plays in the human body?
So the hamstring, as it runs behind in the back part of the leg, helps you to flex your knee backwards. So in other words, you bring your heel up to your butt muscles.
For our clients who suffer hamstring injuries, what symptoms can they expect to experience?
With a complete rupture of the hamstring, you're going to expect significant weakness in pulling your heel up to your buttocks area. You also might, if you're able to touch in that area, you might feel a gap where there used to be connection between the hamstring tendon and the bone. Now that connection is no longer there, and you can feel a gap.
How do hamstring injuries generally occur?
So hamstring injuries generally occur when there's a force that pulls the muscles apart. In other words, sometimes if someone slips on a wet floor and the leg pulls out in front of them, a contraction occurs at the muscle that's too strong to withstand the force, and the tear occurs.
How do hamstring injuries get diagnosed?
Hamstring injuries are diagnosed through a thorough history and physical examination, including the ability to try and palpate the area where the hamstring attaches. The best objective measure for identifying or diagnosing a hamstring tear is an MRI. The MRI, unlike an X-ray, is able to identify soft tissues like the hamstring.
Who's the right medical provider to treat and diagnose a hamstring injury?
The best provider or physician to be able to diagnose and treat a hamstring tear is an orthopedic surgeon.
For our clients who suffer hamstring injuries, what types of treatments do you anticipate they're going to encounter or need?
Typically, with a complete rupture of the hamstring as it inserts into the bony part of the pelvis, that will need a complete repair. The reason that is because the tendon actually retracts or forms that gap that we talked about earlier between the hamstring and where it attaches to bone. Let's look at the next slide that shows how the repair is completed. First, let's take a look at that bony anatomy one more time, where we see how the hamstring tendon attaches to the bone. This is the bony part of the pelvis. This area here is the hip joint proper, where the ball and socket joint, and you can see the hamstring runs in the back part of it. On the next slide, we can see where the hamstring has actually come apart. So typically that's treated with sutures and anchors into the bone. These areas here represent the anchors, and the sutures are then pulled tightly into the bone to try to allow healing.
For our clients who suffer hamstring injuries, what does the future generally hold?
Typically, the future holds for hamstring injuries. There may be a little bit of residual weakness with regard to the hamstring, although that's not always the case as long as a good rehabilitation program is followed. The other thing that can happen is the sciatic nerve, a nerve that's responsible for helping you bend your knee and provide sensation into the lower part of the foot, can sometimes be affected. So sometimes there can be some numbness and tingling into the foot with these types of injuries.
Thank you, Dr. John.
Thank you, Mark.